Johnson.
Hello, good afternoon, everybody.
We have a new pen that we'd like you to sign.
Yes,
It's all in the room. Yes, there you want to.
You're joking.
It is.
Oh, wonderful. Okay, thank you so much. Right, so I just sign here.
If you wouldn't mind being our first record in the book, that's
Yeah, and do you want me to come and present like, do you want to, I mean, you're going to conduct a medical examination. I don't mind.
It's more like screening.
Screening, yeah. So do you want to just a second?
Please get Ben in here. One or two lines. Anything that's my name?
Yeah. Come on. And company City Hall. City. Congratulations on this fantastic new venture for London, right?
Yes, thank you.
Very good, very good. Wonderful. Okay. Thank you. Thank you so much.
Come on, everybody. From the top, inauguration Lyca Health.
Yeah, go on, take it. Thank you.
Does everybody looking jubilant? Yeah. We're going to be enthusiastic about it.
Okay, I'll take 1 second.
Very great pleasure once again to welcome you all here this evening to the opening of Lyca Health, the much awaited, the much anticipated, and it's met expectations if not exceeded them. And you'll be hearing all about the mission behind Lyca Health this evening and what it means to have this fantastic new facility here in the heart of London. And without further ado, I'd like to hand over to our chairperson, the lovely Prema Ali Raja.
Thank you, Chris. Good evening, everyone. As a chairperson of Lyca Health, it's my great pleasure to welcome the Mayor of London, Mr. Boris Johnson, and the other distinguished guests, the launch of Lyca Health. We are confident that we will deliver an exceptional service to our customers, both in Canary Wharf and in the surrounding areas. And to tell you more about our fantastic facility here, let me introduce the co-founder and the chief CEO of Lyca Health, Dr. Manpreet Gulati, an acknowledged clinical leader with over 25 years experience in radiology and diagnostic healthcare sector. Thank you. Please welcome Dr. Manpreet Gulati.
Thank you, Prema. Respected Mayor of London and Member of Parliament Boris Johnson, seniors and stalwarts from the industry here in Canary Wharf and the city, well-known personalities from sports and media, senior diplomats from the Indian High Commission, of course my dear doctor colleagues, without whom obviously nothing is possible, each of whom is distinguished in very highly specialized fields, partners and other providers in the healthcare industry, insurers, my fantastic Lyca Health team, yay! And chairman and the rest of the amazing team at the Lyca Group. I, on behalf of our group chairman, welcome you all to the launch of our prestigious flagship Lyca Health Center in Canary Wharf. Before I say something about our new venture, let me begin by telling you a story. About 20 years ago, when I was working in India, where I was an academic in a professorial position in Delhi, my best friend and I had a dream, a vision to set up a cancer center for the lower middle classes and the poor to provide affordable and accessible high-quality healthcare. We worked hard through the initial entrepreneurial steps, and just as we were about to finalize the land lease for the hospital, my friend asked me to scan him and he had been feeling a bit unwell lately with tummy pains. I did his ultrasound scan the same evening, which showed a large spleen in his abdomen. He was diagnosed with acute myeloid leukemia the next day. He underwent chemotherapy, had remission, and as friends, we then helped to raise a substantial amount of money in those days. In fact, about 80,000 pounds, which was a large sum of money in India at the time, to send him to the University of California, Los Angeles, to undergo transplant, bone marrow transplant. But of the 10 people who underwent the transplant that day, he was the only one who did not survive. And this has haunted me ever since. He died 4 days later of infection. I was at the airport to receive his wife and him in a coffin, and I cried. Cancer had claimed its worst enemy. That day, I can never forget in my life. Since then, there has been a deep down burning desire to make a difference and to relive that dream to bring good quality healthcare to those who cannot afford in the underprivileged parts of the world. When I was headhunted and came to the UK 10 years ago, I soon became friends with our Lyca group chairman, Subhaskaran Ali Raja. And as a doctor, started looking after the family and then soon after the whole company. Subhash, a huge believer in charity and social enterprise, especially in healthcare, was very moved by my story and promised me all his support to make this dream a reality. They say that opportunities strike the prepared mind. Here it seemed that the whole universe was suddenly conspiring at the command of my intention. We have a fantastic team now, especially with Sen Kandia. Where is Sen? Can you raise your hand, please? Sen, he's an acknowledged healthcare entrepreneur as my business partner who has been like my own right hand and a brother, having set up several centers in the past. I'm so proud also to say that we are chaired by Prema Aliraja, who is here, who you just heard, who is very, very passionate about our project and has an inspiring track record with the group's charity initiative, the Gyanam Foundation. I'm indebted to Prem Sivasamy, the group vice chairman, for his constant guidance. And of course, Mark Judge and Sam Smith, who are my core team members. They have an inspiring track record in radiology business. Lyca Health, a mainstream and profile-changing venture of Lyca group of companies, has ambitious plans, but with a long-term vision, certainly, of convergence towards social enterprise in countries and areas of need in the rest of the world. However, even as it does that, we plan to add significant value to private healthcare here in the UK. We believe that wealth needs to be generated in the right way, and certainly for the right purpose. Our flagship venture here in Canary Wharf is easily accessible by foot or all modes of transport, public transport. We are accredited by all private insurance companies. We bring the best of consultants in London to Canary Wharf with comprehensive multi-specialty offering and access to best MRI, low radiation dose CT scanners, digital X-ray, ultrasound, blood and other investigations. The specialties covered are cardiology, neurology, neurosurgery, ENT, gynecology, chest medicine, sleep disorders, gastroenterology, surgery, orthopedics, sports medicine, etc., to name a few. We will focus on the patient experience with an Apple Store kind of an experience, which is technology enabled. The clients will be ushered and escorted throughout the journey. Our doctors would aim to provide ample time slots for meaningful and detailed consultations with the patients. The healthcare records generated at Lyca Health are accessible by the patient or their doctors anywhere in the world. This will be particularly useful for busy executives or those who are traveling. In fact, as I often tell my team in Canary Wharf Centre, the business executive walking in through the door should feel that he has come to attend a business appointment and actually to crack a deal this time with the doctor, rather than feeling a bit vulnerable and out of control because of his ailment. The same first-class experience will be provided at all our sites. Our next site opens in Orpington in 2 weeks' time, and we have a plan to open 12 to 15 centres in the UK over the next 5 years. We are also going to open a Westminster healthcare enterprise in Chennai in India next year, which will further our long-term vision. Even as I say all of this, I'm still at heart a doctor, and the most important thing is I still work 2 days in the NHS, which is really important, and I'm really proud of that fact, because I feel that is really, really important. And we will be helping the NHS off and on in times of need for spillover work, without intending to make a profit there. We wish to work closely with our doctors to improve clinical communication in a timely manner. With the insurers and corporates, we aim to facilitate pathways so that busy people get timely access in a comprehensive manner locally. Please stay back or arrange a visit with me or my team to tell us how we can work with you to make this happen in a customized way for you, which may also help save costs and time off for clients and your employees. We are absolutely committed to help with infallible integrity, impeccable quality, and utmost care. Thank you so much for your patience. Thank you for listening me through. And it's my great pleasure and honor and privilege to welcome our Mayor, Boris Johnson.
Thank you, Clark. Thank you very much. Well, good evening, everybody. Thank you so much for having me along at this historic occasion this evening. It's an amazing comment on the dynamism and success of modern London, that people in our city, my friends, are living longer and in better health than ever before. I'm thrilled to say that just over the last 8 years or 7.5 years, to pick a period entirely at random, the life expectancy of Londoners has gone up. 18 months for women, absolutely true, and 19 months for men. They're catching up, obviously, and there are parts of London now where people live to be, I think in the Harrow Road, life expectancy is now 97 years old at birth. Goodness knows what monkey glands or royal jelly they apply in the Harrow Road. But it is a sad fact that if you take the Jubilee lines, I'm sure many of you do, yes? Going much better than ever before?
Yes.
If you take the Jubilee line from Westminster to Canning Town, life expectancy, on average, will drop by a year for every one of those stops. And that's not because of what it's like being on the Jubilee line, my friends, because as you know, the Jubilee line is now running faster and more efficiently than ever before. It is because we are not doing enough. We are not doing enough to catch some of the big killers in our society, and in particular, cancer. We are not catching cancer fast enough. We don't have the record that they have in the United States or indeed in other parts of Europe. So it's absolutely fantastic to be here this evening and to see this incredible diagnostic facility that I've just been allowed to inspect. 2 wonderful scanners. What were there was an X-ray and something else.
MRI-CT.
MRI-CT, by the way, which was invented in London, 1967, wasn't it? Invented in London, the MRI scanner. It certainly was, I think, in Sutton or somewhere like that, in common with many other developments for the betterment of mankind. And I hope very much that Londoners will benefit from this fantastic facility. I know they will. It's a wonderful thing. Long live this facility. May people long live Lyca for coming up with this brilliant idea. Yeah. Congratulations to you. And may Lyca, let me get this right, may Lyca liking Londoners live longer for using Lyca Health. If you ask me, Subhash, congratulations, and everybody, Subhash, congratulations to you and to all your team on your vision and everything that you've come up with here today. If you ask me what my view is about Lyca Health, then quite obviously it's me Lyca very, very much, and I congratulate you on what you are doing. I have great pleasure. I can't believe I'm really opening this thing, but I have great pleasure, therefore, in declaring Lyca Health Canary Wharf even more open than it was several months ago. Congratulations to everybody. Thank you.